we kick off our election 2014 coverage. Of course, just finished up with a great mayoral race, and guess what? We've got a great gubernatorial race right around the corner coming up this fall, and lots of candidates. And tonight, joining me, one of the Democrats that's in this race. He's a successful businessman, a medical doctor who went into the business world, and now seeking to become the next governor of the Commonwealth. Of course, Governor Deval Patrick announcing that he will not run for re-election. From Wellesley, Joe Avellone. And Joe, nice to have you here.
So great to be here. Thanks,
Thanks
Joe.
so much for joining us.
My pleasure.
Well, so new. Of course, there are some fairly well-known names in the race, but this wouldn't be the first time that a political unknown has come on to become governor. Of course, Governor Patrick kind of breaking the mold, I think. What makes a guy like you think that? What would lead you to believe that you could be elected governor?
Well, first of all, I think you're right that we have elected outsiders into the governor's office in Massachusetts. Not every time, but a significant number of times. Certainly Deval Patrick was our latest example, and he has had a very good run in the governor's office. But before that, we've had other outsiders. Mitt Romney was, Governor Weld was. And if you even keep going farther back, Governor Dukakis, when he first ran, was not the insider. He really went around the state and created his own grassroots organization as a young reformer. So we have a history of doing that, and I believe that it gives us a richer government to do that. And obviously, I believe in the idea of being a citizen politician. I think what I've learned in my 30 years of career in the private sector, I think can be very important for what the next governor faces, and that's why I think I can make a difference, and that's why I'm running.
Who have you kind of, and you talked about a lot of those names of the past, but who do you model yourself off after, or are you totally unique?
No, actually, my political hero, if you will, or mentor, was Senator Paul Tsongas, which many people certainly remember, and I really miss the fact that he's not with us. He was a great senator, a great statesman, but what I liked about him was that he was very pragmatic. He really looked for solutions versus ideology. He certainly worked with both sides of the aisle, but he solved problems, and that's the kind of Democrat I would like to be. And in fact, I was his healthcare advisor for his 1992 presidential campaign, and I was very proud to have done that.
Well, of course, healthcare is on everybody's mind. We've had the health connector here for some time, so it's not quite so traumatic yet. The stories from across the country with the advent of Obamacare, for lack of a better term, and it is raising a lot of issues and a lot of kind of concerns. And if you're the next governor, how would you deal with that? Is it more of the same, or is you obviously work in the industry? You probably know it better than anybody. What would you change?
Well, we have universal access, universal insurance here in Massachusetts. We've had it for 7 years, and it's a system that works. 97+% of all of our citizens are enrolled with insurance, and that's a very important thing. And we are really the first state to have done that. And a lot of what the Affordable Care Act, or Obamacare, is trying to do is to implement that kind of thing in other states. But we already have a system that works. What we need to do now is keep it affordable. And that was always meant to be the second stage. The first was to get everybody insured, and then the second is to make sure that we work with our healthcare delivery system in order to keep it affordable for people. I was the chief operating officer of Blue Cross and Blue Shield back in the 1990s. In the 1990s, we controlled our healthcare costs at Blue Cross. And we also put in place a lot of new preventive medicine programs that have stood the test of time. But that's what the next governor is going to have to do. We are going to have to work with all of our major institutions in the state and change the way healthcare is delivered in a way that keeps it affordable. And I know that I can do that. I do think the next mayor, the next governor, has got to do this. And I believe that my background will make me able to do it.
Well, part of what's going on, of course, and there's a lot of pressures on healthcare costs, but is almost this two-tiered system, these kind of elite hospitals, the Partners Healthcare, the Mass General Brigham's partnership, and there's others as well, a lot of them Harvard teaching hospitals, kind of setting up this system where if you want the best care or you want the, I don't know if it's care, I should say, but certainly service, there's one level versus kind of community hospitals. And is that kind of undercutting our healthcare system?
Well, I think first of all, we have some world-class hospitals in Boston. We're very blessed for that, and they have an important role in research and in teaching. But and it is appropriate to have some of these very sophisticated hospitals versus community hospitals. Not every community hospital has to have all the services that are rarely performed on the most complicated cases. So the system really works best when patients are cared for in the appropriate facility for what is being done. So if it's a simple operation, say it's a simple appendectomy, that doesn't have to be done in a world-class teaching hospital. That certainly should be done in community hospitals. So as our healthcare systems form, as hospitals come together, I think it's important to make sure that they get organized in a way that the care is done in the appropriate setting. So we don't increase the costs in community hospitals just because they're now part of a larger system. The key to all of this is to having the care more coordinated and having doctors work in teams more than they do. Our system, as it grew up, has been very fragmented. Individual doctors making individual decisions, and we've all, I think, experienced what that means for our care. I don't know if you've had the experience, but many people have a loved one, say, that was seen by Dr. A, but then referred to Dr. B, maybe on to Dr. C. The tests don't follow. They often get repeated. Dr. C maybe never even heard what Dr. A had to say. That's very, very inefficient. And more organized care systems have the doctors work in teams so that the information flow is complete. That's much more efficient. And so the two ways to control our costs are to create what are called coordinated care systems with the doctors working more in teams and changing the way they're paid away from fee-for-service, which pays them for every single procedure or every visit and therefore for quantity, and pay them more on the basis of quality, good outcomes for how their patients work. So if we can get coordinated care systems and move away from fee-for-service, that creates these organized systems that will be much more affordable for the long term and actually have better outcomes for our patients as well.
Well, of course, the Patrick administration launched their own cost containment. I don't know if that's the right word, but wanting to take somewhat of a holistic approach, or for lack of a better term as well. Is that working? Well, would you stick with that, or would you change it?
I think that was a good first step. So that was what's called Chapter 224. That's our Affordable Care Act in Massachusetts. That set up a framework that allows us to do the things I was just talking about. But it's going to take a lot of political leadership from the next governor who understands the system, who's worked with all of these healthcare institutions like I have, in order to actually move down the road to changing the behavior and moving into these more organized systems. The first step was collecting a lot of data, and that's what has been going on for the last year or two since that law has been passed. And they've just published the first report from the so-called Health Policy Commission, which shows for the first time in our state across all the care that we may have as much as $29 billion in care that isn't creating better value. So inefficient care, the same inefficiency that I've just been talking about. That's tremendous amount of wastage. And if we can create more coordinated care systems and bring that down, it saves everybody a lot of money. So in the state budget itself, healthcare is now 40% of the state budget. That's huge, and that is cutting out our ability to invest in things like education and workforce development, transportation, things that the state really does have to invest in order for us to grow our economy and create the middle-class jobs that we need here. So controlling our health costs is absolutely critical for the next governor, just for the own state budget. It's also true that it's the biggest problem for cities and towns, and it helps control their budgets as well.
Do you think a lot of that gets lost in all the kind of hoopla over, but politics becomes in many ways like a horse race, and it's just like who's ahead and who's yet that kind of those kinds of decisions, those kinds of numbers, I mean, I'm not saying it's 40% of 29 billion, but let's say you could wring a couple of $1 billion out of that.
Well, absolutely.
Pretty
So,
dramatic.
yeah.
Does that get lost? And how do you make that sale to
How do you make that
voters?
stick?
To really kind of understand how important
Well,
decisions like that are.
What I found is that there's the next governor's got two tasks. One is to create thousands of new jobs throughout our state. Lots of our older cities and towns have 10% plus unemployment still. They're not recovering very well with our overall recovery. And those new jobs have to come from new businesses. In my case, I've actually run a large global business, and I know what we need to do to create the work skills in our education systems to bring those jobs. But the second thing then is to control our healthcare costs. And here's the numbers to remember. We have a $36 billion state budget. 40% of it's healthcare. If it was 39%, that's about another $150 million that could be used for education and some of the things that we know we have to invest in. So these numbers are very large just in the state budget itself, let alone how businesses and families deal with high healthcare costs. We have the highest healthcare costs in the world. So the next governor definitely has to deal with it, not only for our government, but for our private sector.
And how do you make that sale to people? Are they listening? You know, this is a long haul, a tough slog, so to speak. And you know, while you've been wildly successful in your own career, you're not a household name.
That's true.
How do you kind of break through? How does Joe Avellone kind of make that breakthrough?
I think I need to keep emphasizing that the next governor's got two big tasks. The first is to create jobs, and I've done that running a global business, and I know what we need to do to create the work skills here using our education system, and control our healthcare costs in order to make room for the investments we need to make. I think that starts to get through, but I agree with you. I'm coming from the outside, so I definitely have built a grassroots organization. I've been in 129 cities and towns. And as we go into the caucuses, I know I'm going to do very well in the caucuses because of all that shoe leather, that I've really been out there for a year.
Now you got to get 15% of the vote on one ballot at the Democratic Convention in June in order to make the primary ballot.
Yes, that's right.
Will you get there? How are you positioned?
I'm very confident we'll get there. And I've really found a lot of appeal in the cities. So, you know, cities like Boston, many of the neighborhoods in Boston, also I would say Worcester, Quincy, Taunton, Brockton, just to name a few where I know we've got very good support. So I think people in the cities in particular are understanding my message about jobs and improving our education to get the jobs and needing to control healthcare costs in order to make that work.
Now, I hate to tell you this, Joe, but you know that isn't so much some of those hot button, you know, kind of liberal issues that kind of inflame the masses. Talking about that, of course, you know, I think Deval Patrick, you know, he had his own style, but help us to kind of understand, help us put in perspective. How you are compared to Deval Patrick. How are you different? How are you the same for those voters that liked him or those that are looking for something different?
Well, first of all, I think he created a wonderful vision for our state. And I think we don't need a different vision. I think he created a vision that we should continue to try and build on. He had a terrible recession. I mean, we can't underestimate how difficult this recession has been all throughout our state. So even with that, he's made some good progress on some significant things. Certainly, I think education, even though we have more to do. So the way I view it is that I want to keep the same vision for our state, but take on the next series of challenges that we would face in order to realize that vision. So in education, it's closing the achievement gap. We've made good progress on our public schools, but the achievement gap is too large. The underperforming schools still have thousands of kids across our state every year either dropping out or if they're even graduating not able to hold a job that would support a family. We've got to do better than that. We're really failing these kids. So the next big challenge for education is closing the achievement gap. The next big challenge for our jobs is to create the skills in our community and state colleges, vocational skills, and use those institutions much more proactively to understand those skills. And then I know we can bring businesses here. That's been my experience around the world. And the next thing in healthcare is, now that everybody's insured, is to keep it affordable. So I think I follow on his vision by tackling the next big problems. And I've been a manager of large organizations all my career, between Blue Cross and now PowerXL's core business. And I know that I can bring that kind of expertise to our government and take on those next big challenges, keep the vision.
Well, let's talk about ed reform, because that's a big issue here in the
Yes.
city. As a matter of fact, it in many ways drove the mayoral race. Didn't drive John Connolly to victory, but he had great strength based on his willingness to kind of tackle, some people would say dismantle the bureaucracy, the school department bureaucracy, but certainly make great changes. And of course, Mayor Marty Walsh has promised to make great changes as well. What does Joe Avellone do? Do you support the current system?
Well, I think, first of all, education is so vitally important to all the lives of our children and to our future as a Commonwealth. So I have a plan that I have put on my website, and it focuses on two critical goals. The first is closing the achievement gap, and the second is to make sure that everybody is career and/or college ready. In the case of the achievement gap, I'm going to focus on it like a laser. It is going to be my highest priority. I am going to fund it as a special fund in our budget. I'm not going to raise taxes to do it, because I'm going to control healthcare costs, which will create the ability to do it. And it's going to invest in in those schools that are not performing in pre-K, lengthening school day, and an innovation fund that allows us to spend dollars in those schools where we know we have special issues. It may be multiple languages, it may be, and we know those things work. They work in a big way. If someone starts in pre-K, is literate at the third grade, they have a much, much higher chance of finishing high school, or even going on beyond that. So we know that works, and we know lengthening the school day works. So I think the state has to take an active role in those systems, in those schools which are not performing, and provide the things that we know work, like those things. For the rest of the school system generally, which are performing very well, I think we want to make sure that those school systems make everybody college or career ready. And I think the important things there are vocational education. I think we need to bring more vocational education back into the traditional curriculum of the schools.
We used to have it.
We did, we absolutely, and we got away from it. And I think that's to our detriment. You know, we have these regional vocational schools, and we do have some voc ed training in the schools, but not near enough. A lot of people can have good middle-class jobs without having to go on to higher education, and that, you know, is not the way we've been thinking about it lately. But those so-called jobs that are based on science or technology, engineering, and math, the so-called STEM jobs, half of those don't require anything beyond a good vocational school education, and those are $68,000 a year middle-class jobs on average, compared to about $40,000 otherwise. So I think we have an obligation to make sure we have updated vocational education, and we need to continue to use STEM, the science, technology, engineering, and math, in our curriculums at lower levels for girls as well as underrepresented minorities.
Well, you know, some of this, of course, there's been a lot of great ideas in the past, and especially underperforming schools making some pretty dramatic changes. Those haven't gone over so well with teachers' unions sometimes, and these are the very people that will be at the convention,
yes,
deciding whether you get 15% of the vote, Joe, and deciding whether you're the Democratic nominee. You ready to take those folks on? You ready to bump heads with the, you know, some of the powers that be in the Democratic Party? Unions have a great deal of influence and power in the Democratic Party.
They do. Well, with regard to teachers, I think teachers are everyday heroes. So everything that I want to do is to support teachers. It's not to be an adversarial thing. It's not to blame them for our schools. I think we know that it's complicated reasons why the schools that don't perform. All I want to do is provide the resources to make sure that they get better. So I think I'm an ally of the teachers, and I think teachers, especially in those schools, would appreciate the extra funding and attention that we want to give them as a state. I have talked to, I've vetted my plan with union leaders, and I think have taken in their input, and I think so far it's been very well received. I would say about unions generally. That,
Charter schools, there's support expanding charter schools?
well, I think charter schools have a role, but the role is to be innovation centers for public school systems. To me, the bedrock for us is the public school system. That's what we, as a society and as a government, need to support. So long as they're innovation centers in which the learnings can be transferred to the rest of the school district, then I think they have a role. So what that means to me is they have to have the same population. So they have to have the same kind of students. They can't have students that are either have parents that are more interested or only the elite students. They have to have the students that are the same as the rest of the school system. Otherwise, we can't transfer the learnings. So I think there is a role, but the role is to support learnings for the public school system generally, not to create a separate school system or a new school system outside of the public school system or that escapes from it.
Now, what do you see, and again, for our viewers, if you're just joining us, Joe Avellone is Democratic candidate for governor, a successful businessman from Wellesley. You still live in Wellesley,
I
right?
do, yeah. Our kids went all through the public schools there, and certainly
Now,
benefited from that.
how do you see your path to the nomination? What is it that leads you there? Obviously, there's some better-known candidates in the race, but how does a guy like you get there?
Well, let's remember that people have gotten there from the outside, so it can be done. And I started early. I started a year ago. I've been in 129 cities and towns in over 400 events, and certainly that is a big part of it. That's why I know I'm going to do well through the caucuses. And where I've really found traction is in solid middle-class Democratic cities. So, as I said, Worcester, Quincy, along the South Shore, parts of the North Shore, pretty significant areas.
How will you do in Boston?
I think I'll do well. I think I'll do well in Hyde Park, Rosendale, West Roxbury, part of Charlestown, part of Southie. And I've spent a lot of time in the inner city as well over the summer. Went on 5 of those Enough is Enough rallies this summer with Tito Jackson, walked those neighborhoods, saw the paralysis and the fear of the youth violence that's erupted there, and it's tragic. So I think I've got a very good grounding there as well. So I think I'm the candidate for the cities. I really think this is our focus. I think we need to bring back the cities, and my ability to create new jobs, having done it in the private sector and now bringing the idea of how to bring the new skills and controlling healthcare costs to do it is a powerful message. I think I'm the only candidate that has the ability to do both of those things, has done it in Massachusetts, and that is the message I want to take into the convention.
Well, this will come as no shock to you. There's some people that think, well, after 8 years of Deval Patrick, it may not matter who the Democratic nominee is, that some people are looking perhaps to go back to a Republican administration. Charlie Baker, who's also a successful healthcare professional, executive, also in the running.
Well, I can tell you.
Can the Democrats compete this year, or are they? There is some blowback to the administration of Deval Patrick, and how do you see yourself in that context?
You know what? This is. I think I am the candidate that can beat Charlie Baker. I think that a moderate.
You're very similar in some ways. You know?
We are. He's taller than I am, but I'm in the right party. So I've been a lifelong Democrat. I think someone that is a little more pragmatic Democrat like me and is focused on the right things, which I've been all over the state and I know is jobs and education, has a much better chance of beating Charlie Baker than some of the more progressive, maybe more progressive candidates. I can tell you this, if Charlie does get elected, we're going to take 2 steps backwards, because if he is going to run on anything like the ideas that he ran on last time, this is not at all where we should be going. There is a role for government. The role for government is to create opportunity, and the opportunity, in my mind, is often through the education system, but it's a proactive role. I don't think we're going to get that in a Republican administration or a Baker administration. But I think we do get it from me, and I think I am the pragmatic Democrat that matches up better with him.
Well, Joe, I want to wish you best of luck. I want to thank you so much for coming in tonight. Again, Joe Avellone from Wellesley, a former selectman, a medical doctor who went into the business and management side of healthcare, a former COO Blue Cross, and now
Par Excel International.
Par Excel, and hoping to be the next governor of the Commonwealth. Of course, Deval Patrick announcing he will not run for re-election. Joe is one of 5 candidates in the race on the Democratic side. More on the other side, perhaps some independents as well. I want to wish you the best of luck. I really do. I enjoyed having you here.
It was a real pleasure. Thank you, Joe.
No problem. On upcoming editions of Talk to the Neighborhoods, we'll be meeting some of the other candidates as well. You're watching Talk to the Neighborhoods. We're here tonight and every Monday night at the same time. Until next week, I want to thank you for joining us. Have a pleasant evening.